Hello, my name's Emily. I'm going to be your student nurse today. Hand hygiene.
I forgot to add, before I begin the head-to-toe assessment, I'm going to ask the patient for their name and their date of birth because these are 2 identifiers, and I'm going to check the wristband and then get started with my head-to-toe assessment.
Brief head-to-toe assessment. I noticed that the patient is alert and oriented ×3. Pupils are equal, round, reactive to light, and accommodation. Vital signs are good. Temperature is 98.3. Pulse is 72 beats per minute. Blood pressure is 120/80. Oxygen levels are 96. And I will ask the patient what their pain is on a scale of 1 to 10. Now that the brief head-to-toe assessment is over, I'm going to do a focused abdominal assessment. I'm just going to hold this gown up so I can see the abdomen, making sure he's still covered. So first I'm going to inspect the abdomen to make sure the skin's in place, there's no striations, or there's no visible distension, and it looks good to me. So now I'm going to move on to auscultation. So I'm going to listen to all 4 quadrants of the abdomen. And you're going to want to listen to all 4 quadrants for 5 minutes each. If you don't hear anything, just to make sure you hear something. Next, I'm going to ask, I'm going to percuss the abdomen. And now I'm going to palpate last, just in case the patient has any pain. I'm just going to push on all 4 quadrants to make sure there's no pain or no distension or hard lumps. There is a little bit of distension near the bladder, but that's because we're going to insert a catheter, okay? So after the abdominal assessment is over, I'm going to put his gown back down and put his drapes over. And the doctor has ordered a Coude catheter because of your benign prostate hypertrophy, so we're going to put that in now. Let me go get my kit and I'm going to get right started, okay? I'm going to get my kit. I'm going to do hand hygiene. I'm going to put gloves on. Now that my gloves are on, I'm going to make sure the bed is at a good height, and I'm going to put the bed rail down. So I had to stop the video because someone forgot to take the catheter out before. But now I'm just going to expose the patient and pull this down a little bit. Once this is all set, I'm going to get my catheter kit open. I'm going to put it right in between the patient's legs. And I'm going to open it, make sure it stays. I'm going to take the drapes, and to keep them sterile, I'm just going to touch the outside. Like so. And we're going to put the shiny side down, and we're just going to drape it like here. I'm going to take my sterile gloves, and I'm going to put them on the bedside table. And I'm going to take this drape and I'm going to do the same thing. I'm going to put the shiny side down, and this one's going to go right here. Now I'm going to take my gloves off, perform hand hygiene, and I've put on my sterile gloves. Now what I'm going to do is take this and place it right here, remaining sterile. I'm going to take my saline solution. I'm going to take the top off. I'm going to put it right into the port of the catheter. Just keep it right here. Now I'm going to open the lubricant and just pour it out right in the tray. Now I'm going to take my iodine and I'm going to put it on my cotton balls, and I'm going to clean my patient thoroughly. I'm going to take my non-dominant hand, keep it right here. We're going to, in circular motions, clean and ensure that the patient is all clean. You do this 3 times or until the patient is fully cleansed. Now, keeping my non-dominant hand on the patient, I'm going to remove the plastic from the catheter. I'm going to put the tip in the lubricant, and I'm going to insert the catheter until I see urine. Once you see urine, you're going to move your hand and bring it down to the saline. You're going to want to push it through to inflate the balloon so the catheter stays in place. You're going to want to take your saline out and put it here. And with my sterile gloves, I'm going to put this over here. And I'm going to take my catheter out. Now I'm going to take my sterile gloves off, perform hand hygiene, and put on new gloves. Hand hygiene. Next, I'm going to remove the drapes. Next, I'm going to hook the catheter to the patient's leg. Just going to clean it off with an alcohol pad just before we place it on. We're going to make sure you hang the catheter on the bed, not on the bed rails, just on the side of the bed. You're going to make sure the patient is comfortable, put his gown back down, put this back up. Now I'm going to irrigate the catheter. Usually this would be a couple hours later, so I would put this back up and come back into the room, but I'm just going to leave it down since I'm going to irrigate the catheter now. So I'm going to want to take these off and do hand hygiene and put a new pair of gloves on. Now you want to make sure you tell your patient that you're just going to come in, you're just going to irrigate the catheter with a little bit of saline to make sure everything's clean. So I'm going to pull this down, keep him covered. I'm going to get my syringe filled with saline. I'm going to expose him. And first I'm going to clean the port off with rubbing alcohol swab just to make sure it's all clean. I'm going to kink the tube of the catheter just to make sure nothing goes in to the bag. And I'm going to inject the saline solution right into the port. Now once that's done, you're going to want to make sure the catheter is still kinked just to make sure the saline is in there and can irrigate the catheter. And then after this process is done, we're going to unkink the catheter, cover him back up with the gown, put his bed sheets back up, make sure there's enough room on his catheter so nothing kinks, and then we're gonna put up the bed rails. And that's it.